Good afternoon, everyone. I am very pleased and honored to be here with you and to introduce the results of our work. Certainly, it is already known that the right to health is considered one of the most frequently infringed human rights in the Republic of Moldova. And on the other hand, the promotion of general human value, observance of human rights, and fighting against discrimination, they are essential chains in the training of the new professionals in healthcare, which was valorized today by the previous speakers as well. The background accelerating the procedure for the amendment of the university curriculum was also the signing of a collaboration agreement between our university and UNAIDS Moldova in 2021. And this actually established the goal for one activity that lasts for several years already, and we are very proud of it, namely identification of opportunities and strengthening the future professionals in healthcare in the area of knowing and observing human rights, as well as future development of communication skills. The stages of project implementations were several. We started with a stage of developing a methodology by which we planned to scan the entire university curriculum, and we assessed all the training programs for bachelor degree and master degree studies offered by our medical university. In mapping the modules from the plan of study, some disciplines which we consider that they should answer to and form and train those competencies, as well as the disciplines tangential to the HIV infection, non-stigmatization, non-discrimination, and human rights observance. After the analysis and identification of the goals or things that need to be improved, we have passed to the next stage, which was strengthening the competencies of our professors, which actually was mentioned during the first panel of discussions, because it is not enough to have a good curriculum, it is not enough to have these students, these disciplines including in it, but it's also important that the professors that teach those curricula have necessary competence. That's why we trained the professors in human rights and communication. And in the end, we developed a new curriculum and revised 12 existing curriculum with the updating of the didactic materials. So what results we had? Practically in all the plans of study, from bachelor degree and integrated education, we included the human rights in healthcare discipline. And the curriculum has been adapted and enlarged for all the professions in healthcare that are being taught at our university. For those disciplines that tangentially approach the human rights, like pediatrics, obstetrics and gynecology, infectious diseases, family medicine, psychiatry, and other vulnerable topics, the curricula have been updated. Speaking about training and preparation of didactic staff, at the first stage, we managed to improve the competencies of 45 teachers and professors in the area of human rights. 22 professors have been trained in the area of training in assertive communication. Additionally, we have provided services for our students in the counseling and career guidance centers in order to strengthen the competences of the young professionals in this domain. And we also managed to institutionalize the curriculum in human rights in healthcare. And for already 2 years, more than 1,000 students were trained in university training. In conclusion, what actually affected us is the fact that a methodology for curriculum evaluation has been developed, and it may be applied anytime it is necessary to make sure that the training plans correspond to and form those competencies that we wanted to be formed. The evaluation of all the plans from the educational offer of the university have been analyzed, and we analyzed both the facultative disciplines and mandatory disciplines, and we introduced the human rights in healthcare discipline in all the training plans. We focused on strengthening the competences of didactic staff, and they have been trained in human rights, how to teach human rights, how to teach assertive communication, and In the last stage, we also revised the curriculum for clinical disciplines because we cannot count on the fact that only one discipline could totally change the behavior and attitude and non-discrimination and non-stigmatizing attitude. That's why, taking into account the peculiarities of every clinical specialty, we wanted these topics to be like a red line through the entire training of the future professionals in healthcare. But for sure, we will not stop here. We planned a series of next steps. We would like to update our methodological and didactic support for the trainings at all the stages. And we would also like to continuously have a continuous medical training program for the professors of the Nicolae Tistimițanu University in the area of human rights, so that the entire university staff would be trained continuously in this domain. And we would also like to apply those monitoring and continuous updating tools for our curriculum in order to include the human rights related subjects, assertive non-discrimination and non-stigmatizing communication, not only towards the HIV patients, but towards a human being as a person. For sure, what is motivating us is the fact that we want continuity, consequence, and sustainability in all our activity. Thank you so much for your attention, and I wish you a lot of health, and I wish that your rights are being observed.